Olarik, shall I leave you to introduce the next speaker, last but not least?
Yes, last but not least, and this is very important. Our speaker, Dr. Whye Lee, she is a director of a training department, Engineering Research Center of Ultrasound Medicine in China. She is the senior training lecturer of HIFU training based on China, and she is one of the lecturer of the ISMIVS International Society of Minimal Invasive and Virtual Surgery. She is more successfully more than 4,000 cases of a benign malignant tumor treated by HIFU. So please, Dr. Whye Lee.
Okay, can you hear me?
Yes, of course.
Okay, thank you for introduction. I'll share my PPT.
Yes, now I can see.
Okay, can you see my slides?
Yes, yes, yes.
Okay. Thank you so much. I'm honored to have this opportunity to share some very interesting cases and maybe some difficult for a lot of primary doctors for HIFU. The mechanical of HIFU, how HIFU treatment works, our professors have talked a lot. So what do we want from HIFU? During the HIFU, the most important thing is that the safety, the treatment safety, and the second one is effectiveness. And also we want to do this very quickly. That means efficiency. But for now, we focus on the first two parts, the safety and the effectiveness. So what are the factors affecting HIFU treatment? For the patients, the first thing is a BMI. If the patient is a little fat, the abdominal wall is sick, this may be cause some difficulty for us. And also the position of the uterus, the number of the fibroids, the position of the fibroids. Also the blood supply, the intensity on T2. This the factors will affect our treatment efficacy. So today I will give three types. Three types are very interesting type in our treatment. The first one is this posterior uterus. This type means that the position of the uterus affects our treatment, and let's see how this affects our treatment. You can see this patient from the MRI. This is a sentinel T2. We can see this is a posterior, the position of the uterus is posterior, and here is the adenomyosis. For this kind of patient, it's very difficult for us to treat. Why? Let's see. So for this kind of patients, what need we pay attention to? The most important, the first thing is the safety of their QT pathway. Then include the abdominal wall and the bladder, which help us to set safer QT pathway. And also because the position of the adenomyosis, this patient during our treatment, she would feel psychological pain, and also we need to pay attention to the radiation pain, and I need to control the energy. That means we don't give too much. We don't give too much, because for this kind of patients, for this our new type classification for this adenomyosis patients, this is we need to control the energy, because we need to protect the uterine cirrhosis. So let's see this is a persistent before HIFU treatment. We can see the bladder is very big, and yes, the tension is very high, And we can see the focus. The focus is just on the boundary of the adenomyosis. That means we cannot put this focus in the middle of the adenomyosis. So for this kind of patient, what should we do? We ask our patient to do some bladder training. This picture is 5 days later. The patient do some bladder training, then come back. We can see the bladder is changeable and the image is very clear. It's much more clear. And on the focus, we can put the focus just in the middle of the adenomyosis. So we can see the acoustic pathway is very safe because all of this is through the bladder. The bone is in front of the, just outside of the acoustic pathway. And for this patient during the treatment, our doctor do try something. We can say we know that we always can use water balloon to push out the balls outside the acoustic pathway. So they tried. The first picture we can see is just under the bladder, a little to the head side, and we can see the boundary of the uterus. And for the second one, they change the position of the water balloon, and we can see the boundary of the uterus, but also the uterus is very close to the rectum. So under this situation, the patient felt very, very pain. And then the third one, they just move out the water balloon for the water, and we can see the acoustic pathway is safe and the focus point is in the middle. And also the boundary, the uterus is a little away from the rectum. So the patient's reaction of the patient is much better. So for type 1, the posterior uterus, we need to do one thing. That is most important thing is bladder training. Bladder training can help us to build a better acoustic pathway and reduce the reaction of the patient. Now, for this is the contrast enhanced ultrasound image. This is before. We can see the microbubble is in the adenomyosis, and for this part is after HIFU. After HIFU, we can see there's no bubble here. So second type, this type is very important, and a lot of doctors think it's a little headache. Let's should see the video. A lot of fibers here. Even we don't want to count how many. And after HIFU, we can see all the fibers are just necrosis. There is no blood supply here. For this one, maybe we can, we think that it's easy because it's just all the fibers are just in the pelvic. And let's see this one. Too many. A lot of fibers, a lot of big fibers here. You see what kinds of fibers? And after the sonication after HIFU, most of them, almost everyone, only one at the right side. So here, for this one, this big one, this big one, this big one, and a lot of small fibers here. This case is very interesting because during the treatment, we only treat 5 fibers, but the necrosis part fibers is more than 5. You can see here, for this patient, for this kind of fibers is the most difficult one for us. And we only make 5 plans. The first one we treated is anti-cervical myeloma, and the sonication power is 400 watts, and the sonication time is 1 to 3. And we give several cycles, and the patients can tolerate the treatments very good. So we adjust the power to 400 and 2 to 3. When we give 33 seconds energy, and there is great scale changes here, and we reduce the sonication time to 1 to 2. And for this first one, we give 478 seconds time. And then the second one is the anterior and the anterior one. And for this patient, because it's high level, that means it's close to the spine. So after the first fibroid treatment, we just reduction 100 of the bladder, 100 milliliter of the bladder. Then we can lower the uterus, and then we start from 400 watts 1 to 3, and then we improve it to 4. And after 25 seconds, there are great scale changes here too. And for these fibers, we only give 249 seconds. And then we treat the third one, that is anti-fundus. Anti-fundus, and for this kind of, for this one, we only give 149 seconds. And during the treatment, the patient feel a little, several times of skin burning because of the belly hair. And the fourth is at the right central muser. And for this patient for this fibers is very high, and we empty the bladder, and we give 260 seconds. And then lastly, we treat the fifth one. And for this one, we because 30 seconds, we have great scan changes, and the patients cannot tolerate it very good. So we just reduce the power to 300 watts. And for this one, we only give 68 seconds. So the total sonication time for this patient is only 1,204 seconds. So we go back to see the video. We only treat five big ones, but we have more than 5 fibers. We have a lot of fibers that have necrosis here. This one, and for this one, this is the first one. We can see this small fibers. This big one we treated, this one we treated. So for this patient, she gave us some surprise, a big surprise. So what need we pay attention to this kind of multiple big fibers? The first thing, the most important is the safety of our acute pathway from the abdominal wall. For this kind of big one, the belly button is a risk for skin burning, and also the bladder. The bladder, that means maybe we need a small bladder, or even we don't need any bladder. And also for this kind, because the fibers, the uterus is very big and is close to the spine. So the pain, the radiation pain is a high risk. And for the multiple fibers, the key factor is that we need to increase processing of every fibers. We need to which one we are treating, which one we will treat. So I tell our new doctors, for the multiple fibers, we need to make a very good treatment planning. That means identifying treatment goals. That means which ones we are going to treat, and determine the treatment sequence, because we have a lot of fibers. Which one we treat first, which one is second. This is very important. And then we need to make treatment particular plan for every fibers, because every fibers is different, the predation is different, so the acoustic pathway is different. This picture you can see, I always ask our doctors, our new doctors, to draw pictures just like this. We just do some simple, very simple one. This is the uterus, this is the bladder, and the abdominal wall. And this one give you some tips before you make the plan. And this one is just a single one. But if we meet with a lot of multiple one, so for multiple ones, we always draw 3 slices: the mid one, the left side, and the right side. And we draw the circle here. That means there is 1 fibers, and we numbered it, and then we know how many fibers are there, which one we need to treat it first. For example, for this kind one, the C1, 2, 6, 7, 10 is in the posterior wall. And we need to follow the principle of the treatment. That means we first treat the deeper one and then the shallow one. So the first one we need to treat is the number 1 or number 6, and then the number 7 or number 2, and the next one is the number 9. So this is the plan. This is our plan. And also this for this one, we need to, the first fibers we need to treat is number 4. Okay, the third type is also a very interesting one. For this one is a 43 years old patient. Before have treatment, she is very pain during the period. The VAS score is almost 8, and then she don't have the courage to keep her uterus. So she come to me. We can see that there is adenomyosis in the posterior, and also a lot of small fibers in the front, and also there is a chocolate cyst. And I ask her to come to me. I think we have some method to solve her problem. And this is our treatment. So we can see the video. This is before fibroids and adenomyosis, and also this is very stick to the rectum here. So we can see from the MRI that the posterior wall is very close to the rectum. It's very serious, it's sticky here. And for these patients during menstrual periods, the patients even don't want to eat anything because she feels so pain. She even don't want to go to toilet. And for these patients, give me some surprise because I don't have any expectation for the next of the pain during the period. But fortunately, after 2 days after they have treatment, here there was her period, and the VAS score is only 2. And we give her 3 periods of GRH, and then 3 months later, she came back, and we give her, and we performed our laparoscopic surgery for the adhesion, and for the chocolate cyst. And now the treatment is going on. We give her another 3 periods of GRH. So what need we pay attention to this kind of patient? Also, the most important thing is the safety of the HIFU treatment. And for this kind of patients, because the adhesion of the posterior wall to the rectum and is very close to the spine, so she will feel very pain, and during the treatment, and the radiation pain is very serious. And also for this kind of patients, the energy control is very important. If we give too much, maybe there is just the uterine serosa is broken. That's very dangerous. And also for this kind of patients, is if we only give her HIFU treatments, there maybe the symptom will next for a period, but won't last for long. So we give him combination treatments. That means we do HIFU first, and we give 3 periods of GRH, and then laparoscopic treatments. And 3 months later, we will give her or place our urethra. So do some summary. For HIFU treatments for the patients, the most important one we see that we need to give individualized clinic treatment plan. Every patient is different. And during the treatment, every fiber has its own acoustic pathway. That means we need to build individualized acoustic pathway. And also, every fiber is different. The blood supply, the intensity of T2 is different. That means every fiber has different doses. So, and during the treatment, we must remember everything can change. We need to change. Thank you so much.
Thank you, Dr. Whye Min. So are there any questions from the audience? So if not, I have the question. You are the great teacher. You have the student all over the world for now. So my question is, what is the most important skill for doctors who want to do the HIFU? For example, for the laparoscopist, I think one of the most important skill is eye-hand coordination to do the surgery. So, and how about the HIFU? What is the most important skill that we need?
Thank you so much. I think for HIFU, it's not very. Sometimes a lot of doctors come to us, they think HIFU is very simple. Why? Because they think we just sit from the computer and click, and maybe we can listen to the music and drink coffee, and we can talk. This is very easy. But after they come here, every doctor begin the study, they need to come to Chongqing and finish 2 weeks study. And they always told me it's very difficult. It's much difficult than do surgery. I told them, yeah, HIFU is simple, but HIFU also is very difficult. Why? Because when we do surgery, we can see everything just in front of us. But when we do HIFU, we just through the screen. So the image you can figure out is very important. That means you should know the ultrasound. You know the ultrasound very good. But also the clinical skills is very important. You must know the picture. You must know the every the relationship of the body. This is very important. And also for HIFU treatment patients, you must need patience. You need a lot of patience for this. And also the third one is this talking skill. Maybe surprise, because this is different, because this is very different from surgery. You know, surgery, we just cut the bone outside, and you know, we all have the phone, mobile phone, and we take picture, and maybe we just show this picture to the patient's family. So you see, this is your bone in your body. But HIFU, we cause necrosis, but the fibroids is still in our body. So sometimes the patient can not understand this. The patient, the family member can not accept it. So why I have this treatment, I still have the fibroids. So talking skill is very important, the communication.